Hi guys, it's your favorite nurse educator, NP Clark, and I'm back with another cup of the morning coffee. In today's cup, guys, we're going to talk about diastasis recti, or rectus abdominis, which is a term that I like to use. What is diastasis recti? Well, it's a condition that it can really affect anyone, but I'm really going to focus on the women. But men, this can happen to you all based on a rapid abdominal weight gain, overuse, heavy lifting in the gym, and then even to our little newborns, this can happen. But never fret, newborns, this usually will resolve on its own. So, what is diastasis recti? So it's a gap between the right and left rectus abdominis muscles. And it's created by the overstretching of the linea alba, which is a little line up and down here that we have. It's obviously underneath our skin. Some of us, you do have a little darker line on the outside, so you can see that's where your linea alba is. And the linea alba kind of keeps all of the other muscles, I don't want to say in check, but they're all kind of connected there. So the transverse abdominis, the internal, external obliques, all of these muscles that are meant to keep our abdominal organs in, guys, there's a stretch in that. And depending on how severe the stretch is, it can actually be a tear in the muscle. And as I just named 3 to 4 different sets of muscles there, you can have multi-layer tearing depending on how severe. Now, sometimes you probably see that more in women with multiple births or multiple babies born at the same time. So those are things that we want to, be mindful of. So some of the things that you're going to see in someone with rectus abdominis or diastasis recti, I'm going to keep interchanging those because diastasis recti is something kind of new for me. And I'm an old nurse, so rectus abdominis is more the term that I would use. So you're going to see probably poor posture, right? The slumping or the bloating in the abdomen, that muffin top. You're probably going to have some mommy bladder. So a little bit of urinary dribbling. Could be constipation. You can have back pain, and if it's severe enough, you can have really generalized pain because, again, you've got tears in different muscles on different levels. So some muscles are used for breathing, coughing, smiling, laughing, things like that, but they all can create some sort of pain. And then in more severe cases, guys, you may see uterine, rectal, or bladder prolapses, which all will need you to have some sort of either surgical intervention or bed rest, etc., etc. But never fret. I'm going to tell you now how to check to see if you are a possible candidate for diastasis recti. So you are going to lay flat on any flat surface, but it needs to be pretty firm. So if you're going to do it on a bed, make sure it's a firm bed, not a really nice, comfy, Sealy Posturepedic or something. So you're going to lay flat and make sure that your knees are bent and your feet are going to be flat on the ground. Then you're going to take 2 fingers and go just above your belly button, guys. And you're going to gently tilt your head up while you're exhaling. So maybe when you first lay down, just get you a nice deep breath, tilt your head up with your 2 fingers in place. And as you exhale, the muscles here, that right and left, rectus abdominis, they're going to open up and your fingers will just kind of sink right into there. And you want to do this above and below the belly button. Just to check, because just because it's not above doesn't mean that you don't have another set of muscles with a tear. And then some people, yours is going to be so severe that you may be able to get 3 or 4 fingers. So don't freak out. It's still all the same thing. It's just sometimes it's different severities or how your muscles are together in that abdominal area, okay? So we want to take that information, and you don't have to run to the emergency room, guys. One, you probably had it already for a year or 2, because pregnant women can actually develop this up to a year after they've had their baby. So you know this is not something that's life-threatening today. But of course, if you have any severe pains, you want to go get those checked out. But I would suggest that you make an appointment with your primary care provider, and then they will discuss treatments. So regular treatments would be more of a pelvic floor exercises. We know them as Kegels, but there's a lot more pelvic floor exercises and deep core exercises that you can do. And if you're a little more severe, your provider may refer you out to a pelvic floor specialist to really work with you, because here, when you are doing deep core and pelvic exercises, those must be done appropriately to get the desired effects. Because if not, it can get worse. And if it gets worse and there's too many tears, or it's just stretched beyond repair, you would then need to have a muscle repair. But to do the muscle repair, they normally do a tummy tuck. And so I wanted to make sure that I did this video, because I hear a lot of people saying, oh, people are going to get tummy tucks just, because they want to look a certain way. And that's okay too if people want to do that. But sometimes women and even men who've experienced this, if it's so severe you can't get it, that you can't fix it with just different exercises, the only intervention then to fix it and to alleviate your pain, bloating, and as I said, prevent worsening conditions, the prolapses, is to get that muscle repair with tummy tuck, right? So go and get your tummy tuck if that's what you need to do for you guys. Don't worry about what anyone says. We know here in healthcare that this is a condition that sometimes you just can't cure it with just a regular exercise. So I'll leave you with these couple of things that you don't do. You don't want to do yoga back bend poses. Those types of poses, they're going to cause more stretching, and stretching that you don't need at this point if you do suspect you have abdominus rectus. You also don't want to do crunches or leg lifts, especially leg lifts with additional weight, but even just regular leg lifts. You don't want to do those exercises because it can either create multiple layer tears, or it can also just increase the stretching. So, guys, we want to make sure that we are knowing our bodies and knowing what's normal and what's not normal for us. One person's issue may not be your issue. So, this has been your favorite nurse educator, guys, MP Clark, with another cup of the morning coffee. Thank you guys for tuning in. Please subscribe and share these videos with your friends, family, enemies, whoever. It's fine. We want to get this word out. And over the next couple of weeks, the videos are going to be more geared at the different kinds of things that we need to do to start preparing our loved ones and ourselves for transitional care and things like that. And I know sometimes people say, oh, no, we don't want to have those hard conversations, but they are conversations that we need to hear. So tune in Wednesday. I'm going to talk about DNRs, do not resuscitates, and just how that post form really, truly is meant to work. So thank you guys again, and I will see you Wednesday.